Fever in children is a common concern for parents and caregivers. It's defined as a body temperature that is higher than normal, generally above 100.4 degrees F 38 degrees C. Fever is often the sign that the body is fighting an infection, but it can also be due to other causes. Causes of fever in children: infections. Viral infections, such as the common cold, influenza, flu, and respiratory syncytial virus (RSV). Bacterial infections, including ear infections, urinary tract infections (UTIs), and pneumonia. Fungal infections, less common, but can occur, especially in immunocompromised children. Immunizations. Post-vaccination fever. Some vaccines can cause a mild fever as a side effect, which typically resolves on its own. Non-infectious causes. Teething. Mild fevers can sometimes occur with teething. Overheating. Excessive clothing or being in a hot environment can raise body temperature. Chronic diseases. Autoimmune conditions, such as juvenile idiopathic arthritis or systemic lupus erythematosus. Cancer. Rarely, but some cancers can present with fever. Heat-related illnesses. Heat exhaustion or heat stroke, caused by prolonged exposure to high temperatures or dehydration. Symptoms and signs: elevated temperature, the temperature above 100.4 degrees F 38 degrees C. Behavioral changes, the child may be more irritable or lethargic. Other symptoms, depending on the underlying cause. Symptoms might include cough, rash, vomiting, diarrhea, or pain. Associated symptoms: look for signs of dehydration, dry mouth, sunken eyes, or severe symptoms such as difficulty breathing, persistent vomiting, or a rash. Diagnosis: to determine the cause of a fever, healthcare providers may take a medical history. Includes information about the child's recent health, travel history, and any other symptoms. Perform a physical examination to check for signs of infection or other issues. Conduct laboratory tests, blood tests, to look for signs of infection or inflammation. Urinalysis, to check for urinary tract infections. Cultures, to identify specific bacteria or viruses. Imaging studies, such as X-rays, if there is a concern about conditions like pneumonia. Treatment for fever in children depends on the underlying cause. Fever management. Medications. Acetaminophen, Tylenol, or ibuprofen Advil can help reduce fever and alleviate discomfort. Dosage should be based on the child's age and weight. Avoid aspirin in children due to the risk of Rice syndrome. Hydration. Ensure the child stays well hydrated with fluids like water, oral rehydration solutions, or clear broths. Comfort measures. Dress the child in lightweight clothing and keep the room at a comfortable temperature. The lukewarm bath can help lower body temperature. Addressing underlying causes. Antibiotics. If a bacterial infection is diagnosed, appropriate antibiotics may be prescribed. Antiviral medications, for certain viral infections, though these are often not required or used for routine fevers. Specific treatments, for chronic conditions or heat-related illnesses. When to seek medical attention: seek medical help if the fever is very high, above 104 degrees F or 40 degrees C. The fever lasts more than 3 days or is persistent. There are severe symptoms such as difficulty breathing, persistent vomiting, or seizures. The child is younger than 3 months with a fever, as it can be a sign of a serious infection. The child has a chronic illness or is immunocompromised. Signs of dehydration, such as dry mouth, decreased urination, or lethargy. Conclusion: fever in children is often the sign that the body is fighting an infection or responding to other stimuli. Most fevers in children are not serious and can be managed with home care and over-the-counter medications. However, persistent, very high, or accompanied by severe symptoms warrant medical evaluation to determine the underlying cause and appropriate treatment. Always consult a healthcare provider if you have concerns about your child's health or if the fever is accompanied by other worrying symptoms.